Introducing the Perimenopause podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Perimenopause podcast.
Hey, this is Doc Yates, and welcome to Perimenopause. And on today's podcast, we're going to touch base on this before, because just going maybe from a slightly different approach, but I want to talk about your hair. And the reason is that this is such a common concern for so many patients that I have, females that are in perimenopause and menopause, is that their hair is just not the same. It's losing, the hair itself is getting thinner, they're having less of it, and it's just, understandably, it is a big concern. And sometimes things what they'll notice is like, you know what, I used to make a ponytail and I could just barely get my hands around it. Now, like, they'll put their hair back in a ponytail and it's this thin little ponytail. It's just their hair's got so much thinner. And sometimes they get frustrated because, relatively speaking, maybe they have a lot of hair, but it's compared to what it was, it's not the same. So we want to talk about how the different things that can play a role with your hair. Because from the medical system, it's always pharmaceuticals, it's always medications like Rogaine and things like that. Whereas what's happening, and then this is, keep in mind, I am talking specifically about hair loss and hair thinning during perimenopause and menopause. And what that means, that type of hair loss, it's a diffuse hair loss. So I'm not talking about when you're losing hair and like individual little bald patches on your head. That is more of an autoimmune condition. That's very different. I'm talking about just overall your hair is thinning. Sometimes you'll actually see a bit of a receding hairline. And so if that comes up, that would fit into this same category. Okay, so we're talking about diffuse hair loss in perimenopause. Now, the main thing is, like pretty much everything else at perimenopause, it has to do with your hormones. Estrogen and progesterone play a huge role in female hair growth. So, one more time, estrogen and progesterone play a very big role in female hair growth. So, think about, for instance, when you're pregnant. If you have kids, when you're pregnant, your hormones peak. They actually go higher, and you actually end up getting more hair. And it's, for most people, it's the best their hair has ever been in their life is when they're pregnant. And then because your hormones have just gone way up. And then after you deliver and have your baby, the hormones, they go back down to a normal level. Sometimes they even dip down a little bit lower and then they bounce back. And then you start losing hair like crazy, and you're concerned that you're going to actually be losing all your hair. But it's actually just your hair returning to normal. So in these situations, it just helped to, I was hoping that would kind of reinforce the concept, like how much of a difference your hormones play with a role in your hair. So would it not only make sense that during perimenopause, when your hormones are dipping, your hair would be thinning along with it? Look, think of, in pregnancy, more hormones, more hair. In perimenopause, less hormones, less hair. Okay, so what does that mean? It means that you want to catch this early. The moment when you're in your 40s and your hair is thinning, go get your hormones checked. Get them checked from someone who actually deals with bioidentical hormones. Because here's the thing. One, depending on when you're getting your hormones checked throughout if you have a regular cycle, it's going to be different. And then two, part of it's going to be about what your hormones are relative to what you were before. And the ranges are huge. Like they're probably some of the biggest ranges out of any type of lab test. It's like, well, it could be 80 or it could be 800. You know what I mean? So the ranges are so big that they're almost useless. So unless you're dealing with someone who's used to working with that and understands the symptoms, then it's not going to be as helpful. So get your hormones checked, get them addressed by someone who is, well versed in bioidentical hormones and hormone testing. And then get them balanced early, because it's easier to prevent the hair loss. You can get the hair to grow back, but it's so much slower. Like hair, that's one of the slowest things I find a tree is because you have to, for weight everything to grow back, very slow. You can see changes in your nails very quickly, but hair is a slow process. Okay, so the other thing is if you're going to go for that test, you might as well also test your thyroid, your testosterone, something called DHT, so the letter DHT. This is a testosterone breakdown product, and especially if you're getting thinning, like receding hairline, like a male pattern receding hairline, you have to get your DHT checked, and then something called DHEA. So get those checked at the same time. If you're going to the lab, you might as well get it all done within one poke rather than having to go multiple times. Now, the last thing is, now we've got the hormones checked, balanced. You just want to make sure you've corrected anything with regards to deficiencies. And these are things that you've probably already been doing. Most people, by the time they see me and they have concerns about their hair, they've already been on Dr. Google. They're already using things like B vitamins, biotin, collagen. You also want to make sure that you're adding some like minerals, like trace minerals. Another like example of this, you would see people that would be undernourished, and the classic example of thinning hair be related to being undernourished would be a case of like anorexia, and you'll see that much earlier on because it affects your hormones. There's a lot of deficiencies, and it really affects their hair. Same thing, if you're not getting these nutrients in your diet and the proper dosage on a regular amount, that will also affect your hair. So make sure you've got those things balanced out. You should be able to get all of those in 1 or 2 supplements tops. Don't go out and buy all those individually. You'd be looking at, well, for us we use the Essential Effects. The Essential Effects smoothie powder has all of that built into one. So, and you can use it as your breakfast. So like I said, you want to keep it simple. You want one thing, not like 5 things to take, because then you're never going to be able to remember to take them all, and it's too much of a pain to be constantly buying all those things. So you could have your hormones balanced together in one click cream, and then you can have the Essential Effects smoothie, and that deals with everything else. So I hope that gives you some information about the different factors that can be affecting your hair, and you can start preventing the hair thinning and hair loss today. This is Doc Yates signing off.
Thank you for tuning in to the Perimenopause podcast. Don't forget to hit the subscribe button and visit perimenopause.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Perimenopause podcast.